So, Louisa, let me ask you about how this diagnosis and this subsequent events impacted upon your whole life. I mean, particularly personal life, but work as well. I mean, what was the situation with work at the time?
Well, it was very difficult because I'm a freelance PR consultant. I was 8 years into self-employment, got a good client base, and bear in mind, I suppose, recession had hit as well, so things were getting a little bit tougher. But I've still, got a lucrative business. And I was in that dilemma, who to tell and how much I should tell and how long I was going to need off work. And I found in many cases, most clients were very, very supportive. In some cases, I didn't actually tell them what was wrong. I just had serious illness and left it at that. But what I did find extremely useful, Matt Millen has a section on the website about self-employment and what to do in terms of telling clients or customers, or because it is different than being an employee. Obviously there are structures in place for that, but with self-employment you're sort of out there on your own, and you think, well, I don't want to faze anyone, I don't want people to think that I'll never be well again and I'm not up to the job. In fact, there was one of the worst times when I was waiting for the results of my sentinel node biopsy, which was this sort of April time. I actually spent all day Sunday before that Monday writing some very boring copy for some sort of engineering brochure, and it kept me focused. In fact, it was my salvation. Otherwise, I'd have spent the whole day being worried sick about even more worried about the results the following day. So in a way, I did throw myself into my work where possible. I think I underestimated the length of time I would need to recover, because I was in hospital a week, and it was probably another 3 or 4 weeks before I was really able to do much. I think because I'd lost a lot of blood, I was actually quite anemic, and I was a bit tired and wan and achy. But the clients, because a lot of them were on retainer, they were very understanding, and that was okay. But it was later on then, it was when I was getting better that then, it sort of impacted more. And it has been a struggle to keep going.
And what's the situation now with work?
Gradually building it up again. But yeah, I have had some orthopaedic problems as well, which have impacted very badly on that, because only less than 6 months after my breast operation, I had to have hip revision surgery, and I was out of the game for 3 months after that. So, and then I had my reduction up, which had to be delayed because of the hip revision. So it's been a fun 2 years, really.
You had a lot of health issues.
Yeah. But yes, I'm very well. I'm generally very well. Put on a bit of weight. That's annoyed me a bit, but then I think that's my age. So I have to live with that. But
now, sometimes when somebody has a really serious diagnosis and they come through it, their view of the world or their work-life balance or personal life can change a little bit?
Yes, it has a bit, yeah. And I did have some critical illness cover, and because I didn't have invasive cancer, I didn't get a full payout, but I did get a percentage of it. And although we used some of it just to day-to-day living, I did promise myself that we would go on holiday. We'd have a decent holiday in September once the reduction surgery was over. And I did. I thought, so I do now, even at the moment, although I've put in a lot of effort into rebuilding, trying to get some more clients and do some more work, I'm always aware as well that if a chance for some fun comes along, I'm going to take it. I really am. I think, well, things could have been so much worse. So, and I go swimming at least 3 times a week, and I make that part of my week because that is so important to my general well-being. So yes, it does alter the way that you feel about your life, about your relationships. It's an old cliche, and I'm sure the patients would agree with this. You do find out who your friends are. I've had friends who I thought were friends for life who've been absolutely useless. I've had other people who were merely acquaintances before who have been absolutely rock solid. So I'm also in a good relationship. It's been very it's been terrifying for him, but he's been marvellous. And there doesn't seem to be any, we've talked about it, and he doesn't seem to have any issues with my new appearance. He thinks it's a good result. Yeah, and he's just glad I'm well. So.
Well, that's good to hear. That's good to hear. And what are the long-term plans for you now? What do you see for the future for yourself?
Do you know, it's weird. I don't make long-term plans anymore. I just think, it's that whole thing about you can make plans and then life happens.
Mm-hmm.
I have an idea. I plan sort of treats, but I don't. I mean, at some point in the future, my only long-term plan is to move to Derbyshire at some point, which is where John's from. But that's in the next few years, and to have a dog. That is a big part of my plan. But in terms of the usual interview questions, where do you see yourself in 5 years' time? I just think, just live each day, stay well, and that's really how I see it.
And are you enjoying days now? With work building up again.
It is a good thing. And I went through a stage initially after diagnosis of being quite angry and quite short with people who didn't seem to understand the whole change that this diagnosis brings, and I think I'm probably a bit kinder now to people about it. And also through this whole 2 years, I've had two bereavements as well, and so I've had to be there for both people. Well, one of the people is very close to me, and it's her son, and so we do compare notes in the sense of how we now view life. And I think in my terms, mine's much more manageable than her situation, but there are parallels, and we do discuss that about how we don't, as Americans say, sweat the small stuff. We do think, let's just concentrate on the things that make us happy and the people that matter to us, and that's really all that counts.
Yeah, I think that's a nice attitude in a way, and one that a lot of people would benefit from if they could use it.
Yeah.
So,
and I do feel lucky. I feel lucky that if this had to happen to me, it's happened at a point in my life where I'm in a good relationship. If it happened a few years ago when I was on my own, or when I've been in not so good relationships, how would I have coped then? I would have had a very different view of what this illness has done to me, and in this. So yeah, if it ever had to happen, it's happened at the right time. So
I mean, generally people who are on their own, they're relying more on friends and other support that's out there, and sometimes more on those professional links and resources that you mentioned earlier. I am a sort of person who, and this is, John always said, is you buy into it completely. My mum's a nurse, and she's always had this idea that if you have faith in your team, that's a good start. And she's had quite a lot of health problems in her lifetime. And I did that. I was proved right to do so, fortunately. And I think that's seen me through it. I've sort of immersed myself in the process. Big problem, and I think you'll find this, a lot of patients find this, is when you're getting better and your appointments are becoming further apart, and you can feel a bit adrift and a bit lost. Oh, definitely.
Yeah.
That's
and
a big
you can
factor.
almost,
Particularly when the acute treatment's finished, or just going into routine, i.e. irregular monitoring.
Yes, that was...
It can feel quite nerve-wracking.
And the day I was actually discharged from the breast care clinic, which was, when was it? Last year? Yeah, last year sometime. It was last summer. I should have been elated, and I wasn't. I felt actually quite frightened, and I remember saying, if I find anything else, do I have to go back through my GP? And they said, well, yeah, it's a normal channel, but you can always ring up. And so I haven't got my follow-up appointment till my next mammogram's not till November this year. But even so, it was just not going back and seeing those same reassuring faces, and almost because they know you by name, it starts a bit Munchausen, you start to feel a bit special, and then suddenly to be cut adrift from that and think, right, I've got to get on with it now, nobody else knows, it's just that's the way it is.
I mean, in general, it's a good sign to be in that phase where they don't have to follow you
it's great,
with so much scrutiny. But having said that, I think we should have a more gentle transition and some services which I think are available in the Scandinavian countries. They call it rehabilitation oncology, where they're trying to get you back to normal life.
Yeah, I would recommend that. In fact, having when it was the penultimate appointment and I'd gone to, there was a little bit of problem with the nipple. The new nipple wouldn't heal properly. Well, it was all right. It didn't. That had to have some new dressings on it. And I remember going back, and I was a bit down that day. And normally I've been fairly upbeat. And one of the nurses saying, "I think we need to refer you to the Royal, to the psychology side of it." And I was quite surprised. Oh no, I'm coping. But then I thought, no, that's a good thing, and that has helped. Definitely, it's helped me a lot because I've been able to sort it out in my head where I've been and where I've got to, and yeah, I think that's a really marvellous service, and I very much hope, for the sake of other patients, that it continues. I think it is healing the mind is just as important